ಸ್ವಲ್ಪ okay, sorry, we'll somehow try to ಕಾಣಿಸುತ್ತಲ್ಲ? Yeah, we'll continue. Okay. So what I was trying to tell you is we spoke of graphites in the last class, and do remember the importance of miasms in understanding materia medica, and it's predominantly a psychotic remedy. Done? So that's what we are trying to understand. I'll start with another remedy. Now before I start this remedy, I just share a small case, and from the case we'll try to understand the remedy. Okay. Again, a remedy which is very often used in our day-to-day practice. Okay. One emergency had happened a few months back in my clinic. Okay. And one young man in the waiting area, he fainted. Okay. I was seeing some other patient in my chamber, and then the wife and the other patients, they rushed into my chamber telling, sir, there is an emergency happening. Very rarely in a homeopath clinic we see emergencies happening. I hope you all agree, because there are people who are very happily waiting for us because they are used to our case taking. They know that we take a lot of time with the patient, and very rarely we see emergencies happening in our clinic. Though we have good remedies for emergencies, we rarely see emergencies happening in a clinical setup in a homeopath clinic. So this was one such incident where, you know, the attender, the wife and the people who are waiting in the waiting area, they are inside the chamber, sir, there is an emergency. Now what is that emergency that had happened is, one young man had collapsed. You getting my point? One young man, 39, 40, 42, don't worry about the age, he had collapsed. Okay. Now, as a third year student, what comes to your mind? I know it's too early a question. I know you are still in third year, but I know your capacity. You are capable to answer this question. So what do you feel could have been the problem? And as a homeopath, how do you manage this case? Okay, there could be hypotension, possible. Okay, beautiful. It could be hypoglycemia. I appreciate. Huh? Acute MI. Yes, possible. Acute MI. Okay, I have not given you the symptoms for you to differentiate. I told young man collapsed in my clinic. Done? Done? So this is where the knowledge of your allied subjects plays a very important role. So what are all the small things that you keep looking at? What are all the small things? You need to look at the pulse. Okay. You need to look at the blood pressure. Okay, you need to look at the respiratory rate. Okay, if at all you have a pulse oximeter in your clinic, which after COVID all of us have. So you also check for the oxygen saturation. Good. Anything else? Huh? Yeah, if how is the body surface to feel? Okay, is it cold or is it warm? Okay, good, makes sense. GRBS, yeah, if you have a glucometer in your clinic, we also check for the GRBS. Good, beautiful. Anything else? What else you want to do? Okay, you also look for the pupil. Yeah, good. Okay, whether he is conscious, unconscious, you check for the consciousness. Okay, good. Okay, no problem. I know you are going to the postings also. So a lot of things you have learned. This is a simple case. See, for us, you know, when somebody collapses in the clinic, it becomes an emergency. And if you are trained well, if you are trained how to look into the emergency, is a beautiful thing. You know what happened? He had collapsed. And as you told, we did a lot of things like you told. And after a few minutes, you know, we decided a remedy, and one remedy, because he had collapsed, he was not very conscious, so we could not put the medicine into his mouth. So Dr. Hahnemann, in later aphorisms, he says, oral medication is not the only route of administering medicines. You can also administer medicine through olfaction, through skin. So keeping his state in mind, one medicine we had asked him to inhale, and you know what happens after 5-10 minutes is This gentleman gets up and he walks in. More than me, the attenders, the bystanders who were seeing what all happened, they were very much impressed. Because homeopathy can do wonders. And within a few minutes he just gets up, he walks in and he narrates what all happened and all. So it was a state of collapse. And the reason why he had collapsed here is he had high fever. Okay? So please do ask the wife what had happened, for what reason they came to your clinic. So they came to my clinic because he had high temperature. Okay. Chinmay was talking of MI. And immediately after he woke up, meaning he came out of the collapse, I did an ECG done. And ECG shows absolutely normal. But good thinking, MI is something that should come to your mind. Okay. Sudden collapse, body goes cold, done. So you have to rule out acute MI. Okay. So now this man beautifully comes out of collapse. Okay. Now the remedy that I had given to him, and luckily this gentleman permitted, he has shared his experience through a video, and for youngsters like you to benefit what had happened, his wife and he, what had happened outside the chamber, and after medication what happened, and all those things. Okay. So that was one simple case. And recently we also had a case of gangrene, which had to be amputated, and unfortunately they did amputate. It's a big story, I'm not going to the story part. But after this particular remedy, there was bleeding which came up. Please understand the seriousness of the case. In a very big hospital, the surgeon had made a mark telling this much you need to remove, amputate, cut off. Okay. She was my patient. She did not improve the way I expected her to improve, and I myself had said, please do take a second opinion, because she is not improving the way we wanted her to improve. Okay. Though amputation I knew is coming up, but we tried our best to push or to save her limb. With the consent of the patient, we did try our best. Okay. Unfortunately, she landed up in the hospital. But they did not give up the faith in me, nor I did not give up the faith in homeopathy. So I continued giving my medicines as per the totality. And after a medicine, bleeding started happening. Now what is this? Is it a good indication or is it a bad indication? Why good indication? All of you are for good indication. All of you are for good indication. Third year students, gangrene. What happens in gangrene? Necrosis. Good. Ischemia, necrosis, and death of the tissue. Beautiful. Good. So what do you see here? After your medicine, if bleeding is happening, what is it? Beautiful. That's the word. Revascularization is happening. Okay? Done? So a remedy which has a capacity to bring in circulation, a remedy which has a capacity to bring a person out of collapse. Okay? Provided the symptoms match. Not every case of not every case of collapse or not every case of gangrene you prescribe this particular remedy. But it has its own beautiful indications. So the other carbon that I will be taking up today is a remedy which can bring in life. From our books, fine, from our old authors, great authors who have written, they have shared beautiful experiences of their life with this particular remedy. So the remedy that I am going to discuss today is what is this? It is charcoal, simple charcoal. Okay. Now this charcoal, when Dr. Hahnemann, I know many of us will laugh. What's a charcoal? Can charcoal do all these things? Is what you will be feeling. But when this charcoal is potentized, fine, it does wonders. Okay. So we'll see, or we'll try to understand more about Carbo Veg. Dr. Hahnemann was the person who proved a very deep acting remedy, Carbo Veg, meaning vegetable charcoal. You also have a remedy, Carbo animalis, which is prepared from the animal charcoal. So this is prepared from vegetable charcoal. Okay, a very deep acting remedy, and predominantly you see Carbo Veg mainly acting on GA. Okay, GA, mucous membrane of the GA and mucous membrane of the respiratory tract. The main action. Okay, so now acting on the GA, what exactly Carbo Veg does? It causes slowness of digestion. The digestion becomes slow. We also saw this in graphites. What was the word I used there? ATONY, atony. Okay. So here it is causing slowness, slow digestion done, and you will see indigestion here, and lower down you will see constipation. A very good remedy for constipation. Okay. Now on the respiratory tract again, Carbo Veg is a beautiful remedy for asthma, for cyanosis, which we'll explore a little later. But for time being, a remedy having action on the mucous membrane of GA and mucous membrane of the respiratory tract. That is the first action. And second thing, as you see here, like many carbons, it mainly affects the lymphatics. Mainly affects the lymphatics. Okay. And probably that is one reason why the discharges in Carbo Veg will be offensive, acrid and offensive. Okay, acting on the lymphatics, it will cause offensive and acrid discharges. Now the third area, very important, is blood vessels. We saw that it is a very important remedy which will cause stagnation. There is a word used in many books, and they say stasis. What is stasis? So the normal flow will be affected. So normal blood flow, normal urine flow, any normal flow, that will get affected. So what do you see here? You see stagnation. Okay, fine. Venous stasis. On the venous system, on the blood vessels, you see Carbo Veg acting and causing venous stasis. Venous stasis, very important. Now next very important thing is, it's a glandular remedy. It mainly affects glands. It's a glandular remedy. And yeah, so to keep it short, in today's class we are trying to explore a very important remedy, a life-saving remedy, a remedy which is mainly indicated in end stages, last stages. Okay, and deep acting, and main action what we saw was mucous membrane of GA and respiratory tract. Good. Undu. Second, it will affect the venous system, causing stasis. Lymphatics, it will cause offensive discharges, and it's also a remedy acting on the glands. It also affects all organs, male, female, everything. I'm just giving you the predominant action of Carbo Veg. Okay, so we will try to understand a little more in detail. We look at the ailments from what are all the causative factors of Carbo Veg. Okay, see one important ailment. Any quick interpretation? What could be the ailment in Carbo Veg? Very good. So loss of fluids. When we give fluids to a patient, we try to give IV fluids to a patient who has got loss of fluids, meaning dehydration, vomiting, or something like that. Okay. So loss of fluids, it could be blood, it could be, I was trying to tell you about diarrhea, I was trying to tell you about vomiting. Okay. It could be excess bleeding, menorrhagia, metorrhagia, or excess, emissions. Man having 3-4 times nocturnal emissions, and morning he feels tired. Okay. One remedy you can think of is Carbo Veg. There are plenty of remedies. Other remedies for ailments from loss of fluids. Okay, China. Yeah, China. Okay, platina, ipecac. You also have another remedy, an acid phos. See, remedies will keep increasing. When I say carbo veg, it does not mean it is only carbo veg. When it is only carbo veg, I will mention. But here, carbo veg is one of the top remedies which has ailments from loss of fluids. Loss of fluids. Okay, very, very important. And second thing, Hahnemann's time, mercury was something which was abused. Ailments from bad effects of mercury. Second. And third thing is ailments from eating spoiled fish and meat. What is it? Ailments from eating spoiled fish or meat. Can you give me some examples? Arsenic, yeah, arsenic is also a remedy for eating spoiled food. But when it is specifically fish, which are the other remedies? Another remedy you should remember, ailments from eating spoiled fish, allium cepa, natrum, phosphorus, yes, agreed, natrum salt, phosphorus, okay, allium cepa, arsenic amal, carbo veg. See, arsenic, how is it different from carbo veg? Arsenic can be any food. Arsenic is mainly for food poisoning. Okay. Here in carbo veg, when the symptoms specifically comes after eating spoiled fish or spoiled meat. In arsenic it could be spoiled vegetables, it could be spoiled food. Okay. But in carbo veg it is very specific. It is after spoiled fish or spoiled meat. Okay. So going ahead, what we also have here is ailments after antibiotics. Very important. Okay. Now here, after antibiotics in carbo veg, what will happen? So when you have a situation tomorrow in your clinic, you have a patient who has come to you with bad weakness. He feels very tired, he feels very weak. Okay, and it is every time when I take antibiotics, doctor, I feel tired. The remedy is carbo veg. Only remedy which has weakness from antibiotics. Only remedy, carbo veg. Okay, ailments from antibiotics, ailments from drugs. Ailment from drugs. Okay, and never well since an acute illness. Okay, he has had some acute illness. Fine. He had fever, he had viral fever and he had not recovered after viral fever. And one more beautiful remedy, like we all, at least I have used in my practice, there was bad hair loss after COVID. I don't know, many of you would have had this complaint. Hair loss after COVID or after a debilitating illness, one remedy was carbo veg. I had a very good improvement with carbo veg. Women would come to clinic complaining, sir, everywhere, any room, any place in my house, it's all full of my hair. Okay. So the reason was after COVID. Carbo veg was a beautiful remedy which was prescribed with good results. So ailments after eating fatty food, okay, ailments from excess salt, vegetables. What is this? Ailments from getting, what is this image? Sun. Ailments from getting overheated. Okay, you get overheated and then you have complaints. Other remedies? Okay, see, natrum has issues with sun. Sun is not the only reason for getting overheated. Okay, for example, you are wearing 3-4 blazers, or you are wearing something like, for example, sweaters, something like that, and it's very hot and you are not exposed to sun. There again it can be taken overheated. Not necessarily it should be from sun. If it was from sun, I would have written ailments from exposure to sun. What have we written here? What have we mentioned here? Ailments from getting overheated. Okay, better remedy. Getting overheated. At least 2 remedies for you from your side. There are the more than natrums. Think beyond natrums. 2 remedies, simple remedies. Ailments from getting overheated. They are jorage. Correct. Bryonia is one. Second. When you are told bryonia, which is the second remedy? Ailments from getting overheated, ailments from getting exposed to sun, ailments from river bathing. Huh? Sentimental in moonlight. Anti-crude. So ailments from getting overheated. You also have brevenia. You also have anti-crude. And of course natrons. Okay. So here ailments from eating butter. Fine. Ailments from eating butter. Okay. And ailments from alcohol. Ailments from alcohol. So these are few causative factors. Hope the causative factors are clear. We started with loss of vital fluids, and we ended with what is it? Mercury. Drugs, spoiled fish, antibiotics, getting exposed to sun, sexual excess, salt. Okay. Never well since an acute illness. Very beautiful ailment. Don't forget this. Never forget this. Beautiful ailment. It can be very, very handy. Now we'll just look at the physical appearance of Carbo Veg. Many carbons, it's a common feature. Many carbons, for example, you see graphites, you see Carbo Veg. Tomorrow I'll be talking to you about petroleum. Majority of the carbons are obese. Okay? Not only obese, what is the other very important thing? Insolent. Very lazy. Huh? Okay, this is something that is compared to snail. Snail is known for slowness. Not that it is lazy. It is slow, it is sluggish. So carbons are very sluggish. Carbons are very slow. Carbo Veg is very slow. Okay? And the doctor has asked him to go for a walk in the morning. Fine. So what is the Carbo Veg person doing? See how he is taking his dog for morning walks. Okay, this is the extent of laziness you see in Carbo Veg. Very indolent, very lazy. Okay. So we'll look at the characteristic symptoms. Any quick questions here? To keep you in track, what did we discuss? We started with a very important remedy, and the remedy was Carbo Veg. Two important components we have covered. One is sphere of action. Though it is a deep acting remedy, we identified 4 areas. Okay, mucous membrane of GI, respiratory, lymphatics, venous system, very important, blood vessels, and of course the glands. Okay, and we looked at the ailment, and now we are looking at the characteristic symptom. One thing that strikes out very loud and clear in Carbo Veg is it is a remedy for collapse. I could very quickly solve that case with Carbo Veg. See, try to imagine, otherwise if we had failed in that case, they would have taken him to emergency. You agree? And you know how things will be in emergency. Fine? ECG, echo, this, that. A lot of things can go in. But here I was very clear. He had fever and he collapsed because of fever, and he had all symptoms of Carbo Veg. Now that is what we'll try to understand here. What are all the collapse symptoms of Carbo Veg? In collapse, how will Carbo Veg present himself? Okay. So what we saw is there will be coldness. Like acute MI. When you have acute MI, that is the kind of coldness here. Circulatory failure. Okay. Fine. Circulatory failure. And then excessive perspiration, and the sweating is cold. Cold, clammy. Wet, cold, sweating. Okay. Circulatory failure. Done. Collapse because of typhoid. Collapse because of fever. There will be difficulty in breathing. The pulse would have gone up. Okay. Coldness. Done. So these are few important things you will have to remember under collapse. So one is collapse, and second thing what you also have here is, if you are NASH lovers, what you have to understand is trios of flatulent remedies. Trios of flatulent remedies. So what is it that you have to remember here is 3 top remedies.
Lycopodium, Carbo Veg
And China. See, when Dr. Nash says 3 trios, not that these are the only 3 remedies, they are the top 3 remedies. Flatulence you have got a lot of remedies, but Carbo Veg, Lycopodium, China are 3 of top remedies for flatulence. Okay. Now we will quickly look at the Carbo Veg flatulence. So Carbo Veg flatulence is mainly upper. Okay. The accumulation of gas is mainly upper, and in Lycopodium it is mainly lower. The lower abdomen is full of gas, and naturally in Carbo Veg they feel better by passing flatus. Passing flatus. In Carbo Veg they feel better by eructations. Belching. Eructations will give relief. If it is both upper and if it is both lower, then the remedy is cinchona. In cinchona they will be neither better by burping or they will be better by flatulence. When the entire thing is affected, it is cinchona. Only upper it is Carbo Veg. Only lower it is Lycopodium. Hope it is clear. Simple. But it is one of the trios of flatulent remedies. Okay. Now we will also look at this point, and this is something I already told you. Where somebody has not recovered fully from the effect of previous illness. That could be a situation, or when the person is on deathbed. Okay. Or when the person is on deathbed. You know, there are a lot of remedies. Carbo Veg will have its own indications. Okay. There is respiratory failure, there is cardiac failure, and they have gone into collapse. They are not able to revive the patient back to life. Carbo Veg can be a beautiful remedy. You are getting it? Okay. So this is also very, very important. In collapse, Carbo Veg wants fanning. Naturally there is that, what is it? Air hunger. There is air hunger and they want to be fanned. Fanning in Carbo Veg will be from close. Okay. You also have another remedy. They also want fanning, but fanning from a distance. If fan is there, I am here, it's fine. That is not Carbo Veg. Carbo Veg wants fan close. Fanning close. Okay. So which is that remedy? They want fanning but from a distance. Which is the remedy? I suppose it is over for you, and that remedy is no, not pulsatilla. Pulsatilla wants open air. Good, no issues. Pulsatilla wants open air, but wants fan, but from a distance. That remedy is lachesis. In lachesis, they want fanning from a distance. In Carbo Veg, they want fanning from a close thing. Okay. So fanning and is a hemorrhagic remedy. It is a hemorrhagic remedy. By now you know many hemorrhagic remedies. Lachesis, acids, ammonium, good. 3. Phosphorus, cinchona, good. Yes, it's there. Nitric acid, yeah, many acids. Nitric acid, phosphoric acid, sulfuric acid. Okay. Phosphorus itself. Okay. So now what is it when I say it's a hemorrhagic remedy? The next question that comes up is the character of hemorrhages. Okay. Character of bleeding. How is the bleeding in Carbo Veg? Yes, very good. First thing, slow. I am happy with the interpretation. Slow. See, in Carbo Veg, the bleeding will not be gushing. You don't see gushing. Like many times women come to our clinic, they say menstruous flow is gushing. Carbo Veg is not the remedy. In Carbo Veg it is slow. It may be there for 10 days, 12 days, but slow. Fine? Okay? Slow, dark. Somebody used the word venous. Passive hemorrhages, dark hemorrhages, slow hemorrhages. You don't see a gushing flow in Carbo Veg. Okay? Hemorrhage can be from any orifice. When I tell you about particular symptoms, I will be telling it can be from the nose, it can be from the anus, or it can be from the gums, any orifice. But it will be dark, it will be slow, and it will be passive. Okay. Now, what Carbo Veg likes? They generally like citrus things. They also like salt. They also like salted things, namkeen. Okay, salted things. And one more very important desire you also have is, what is this? How do you drink coffee? See the size of the cup. Yeah, see the size of the cup. Fine. They like coffee. They are coffee lovers. Not all coffee lovers are Carbo Veg. Carbo Veg loves coffee. Fine. Okay. So desire salt, sour coffee, and they generally have an aversion to meat. Okay. Aversion to alcohol, and aversion to fatty things, and aversion to milk. Milk, meat, and fatty things. See, going ahead, or the next thing, what you also see is, let it be any discharge. Okay, discharge from the ulcer, the gas, the burp, or any discharge in Carbo Veg will be offensive discharge. Okay. Okay. Now, before I talk of mind, we'll quickly try to understand the characteristic symptoms of Carbo Veg. What did we understand here is that it is a remedy which is given for bad effects of or never well since an acute illness. Okay. Dr. Sir, I had fever. Fever is gone. But from the time I have fever, no doctor, I am not fine. I either have hair fall, or I am feeling weak, there is no appetite, whatever. Never well since an acute illness. Carbo Veg. There are plenty of remedies. Carbo Veg is also one of the important remedies. First. The second very important thing what we also saw is state of collapse. What will be the symptoms? Coldness, icy coldness, clammy sweat, cold sweat, wants fanning, ear hunger, fan from close distance. Very important. If it is from far distance, if it is from a distance, it will be lachesis. Okay. And then we also saw the desires, the aversions. Okay. And then we saw that there are hemorrhages, and the discharges are generally offensive. Anything else? Huh? Yeah, very important. Trios of flatulent remedies. Okay. So moving ahead, we'll quickly try to look into the mind. See, mind of Carbo Veg is a beautiful topic, but I limit myself keeping the students that I am addressing to. I am addressing to a third year student. So I'll just give you what is required for you. Okay? Done? At least, because Carbo Veg, if you look at the source books, if you look into your repertory, plenty of symptoms. Next 10-15 minutes, I'll try to keep it short. Okay? And we'll try to understand. See, now to start the mind of Carbo Veg, like we did in graphites. First very important thing, what you have in Carbo Veg is, they are very timid people. They are very, very timid. And what you also see in Carbo Veg is, they are very quiet. What do you understand by quiet? People who don't talk much. They are introverted. They are reserved. They are talk indisposed to. They are people who are not like being spoken to. They are very quiet. When you ask, describe about yourself, sir, I am a guy who will not talk much. Or the mother, the wife might tell, sir, he is a very quiet guy. He is up to himself. Okay. So one of the remedies that should come to your mind will be Carbo Veg. Okay. Now what is the next question that should come to your mind? When somebody says, I am very quiet. Why? Why are you quiet? That will be a tough question to answer. Yeah, there are people who can immediately tell you reasons. So for that we need to understand what could be the probable reasons why a person is reserved? Why a person does not talk much? Why a person is quiet? What could be the probable reasons? Okay, there can be insecurity, there can be lack of confidence. Yeah, there are many situations, when we ask, so why should I disturb others talking? Probably. Good. Why should I disturb somebody? Or I don't have that confidence to go and talk. Good.
Fear of getting cheated.
Okay, fear of being more than cheated. Okay, I'll combine all this. Fear of being embarrassed. Out of embarrassment, you don't talk. Okay. See, talking, somebody will not cheat you. Why will somebody cheat you? How can somebody cheat you? By just talking. Or you being quiet. You are quiet because you are afraid he might cheat. Probably it can come up, but that will be at a higher level. Must be in the background he would have been cheated by many, and now he wants to be careful. Oh no. I have been cheated. So he becomes very withdrawn. Probably because of his past experience. Could be. Okay. Any other reasons? Huh? Yeah, they might have fear of being judged. Again, your generation people, this is the commonest reason they give. Sir, I am afraid of being judged. Yeah, could be. Fear of being judged, out of embarrassment, lack of confidence. That's the only reason. Anything from this side? Yeah, probably. Some past experiences. I was not like this before, doctor, but I've had bad experience. Since then, no, I'm not talking. Yeah, she's making it more simple after marriage. She says many men will not be allowed to talk, sir, after marriage. Okay, so that's her take. Okay, anyway, no problem. Only that. Any other reasons? Okay, so who are the people who feels it is time waste? Good. It may not be directly what she is trying to tell, but she is giving you a clue. Please pick up from their clue. Why you don't talk? Who will talk to him? Waste of time. Yeah, you saw my language? I did not touch. Sir, talking to him will be waste of his time. No. Why I will talk to him? Who am I? And why the hell I should go and talk to him or she? Fine? She is not my level. Fine? So there are people who are haughty. Yeah, see, that's the tragedy. When we say haughty, one way it is good. You all think of platina. But what is the other effect is, platina is not the only haughty remedy. You are getting my point. So I will be happy when you say haughty. But as a material medical student, or as a material medical teacher, I will be more happy when you all say platina. But please don't limit only to platina. There are many more remedies which are equally haughty. But you all know platina is the haughtiest. So that's why you are all telling haughtiest platina. Okay. So you don't talk out of haughtiness. Fine? You don't talk out of indifference. Yeah, why I should talk to him? Not that you are haughty. From the expressions you can make out, you are not bothered, you don't care. So that's more of indifference. Commonest reason why you don't talk is out of shyness. I don't know if that comes from fear of being judged. I'm not sure what you meant by that. Out of timidity. Okay? Fine? Out of timidity. You are a very fearful constitution. So you keep yourself introverted, you keep yourself to be reserved, and you keep yourself to be quiet. Carbo Veg is a constitution which is introverted, which is quiet out of timidity. They are very timid people. Then we also saw Graphites, which was timid. Beretta was also timid. Yeah, a lot of them. Calcarea, they were timid. Now Carbo Veg is also timid. Fine? So, I was reading my sir's Material Medica book. There he says, a typical Indian wife, when she's been sent from her family to the husband family, lot of gyan is given. Fine, you should not do this, you should not do that and all. So majority of them are like Carbo Veg, who are very silent or timid. But in this situation, you can also have a staff lady. Okay? You can also have a staff lady. Now, how will a Stephysagria lady act or react in this situation? Mother-in-law keeps taunting, husband keeps poking, or father-in-law has something to tell. Everybody has something to tell. How will staff react? Staff will get angry. Fine? And staff will not show anger. At one point of time, that anger is shown in terms of throwing things, or that anger is shown on inanimate objects. Fine? You show it on TV, you show it on remote, you show it on your phone. But Carbo Veg is a guy or is a lady, whoever it is a patient who is very timid. Fine? They also get angry, but that anger in Carbo Veg is expressed in terms of sarcastic comments. You getting my point? We also saw that in graphites. Graphites was also sarcastic. So Carbo Veg also will be sarcastic. Now what is that sarcastic statement trying to tell the mother-in-law or father-in-law? I am not taking it anymore. I know what you people are doing. Fine? She is giving you a sarcastic statement. Done? So in Carbo Veg, the timidity is expressed, or that anger is expressed in form of sarcastic statements. So they can be sarcastic, they're timid, they're quiet, they're introverted. Okay, fine. And as the pathology progresses, they can have issues with memory, loss of memory, weak memory, fine. And that stasis, that stagnation, that slowness, all those things can slowly start setting in. This is the psychotic picture of Carbo Veg. In the Sora, you have more of timidity, you will have more of anticipation, you will have more of quiet disposition, reserved, all those things. In psychosis, slowness, sluggishness, memory issues, weak memory, all those things will come up. And in syphilis, what did you see in graphites? You saw women acting mannish. Okay. So in Carbo Veg, it's also a carbon. You can see mannish things in Carbo Veg also. It's a carbon. But it's more of graphites and petroleum, which is mentioned under mannish. In Carbo Veg, you'll be seeing more of indifference. Okay. They'll not care. The mother-in-law, the father-in-law, the husband, the children, the family, whoever has insulted her, commented her, she might start not caring for them. This is what will happen in the syphilitic phase of Carbo Veg. So in Sora, the timidity, the shyness, all those things. In psychosis, the slowness. And in syphilis, what you see is mainly indifference, not caring. Indifference to whom? To family, to husband, or I was just trying to tell you, mother-in-law, children, or father-in-law, whatever. So this is Carbo Veg. Okay. For a third year student. Done? In the next class, we'll try to apply all this under the heading particulars. Okay. Any quick questions before we close? Yeah, this is all related to the memory. Okay. Any quick questions to us? So to sum up, three components. One is sphere of action. Second is ailments from. Third is characteristic symptoms. And last thing that we just finished was mind. Okay. So next class the next class will be based on three components: sphere of action, ailments, and characteristic symptoms. If you have understood these three things, then we can quickly go from head to toe, and we'll try to do justice covering the topic. Okay. Chalo, thank you.